So for this second session, we're going to actually look just quickly at pain assessment and what constitutes a thorough pain assessment. So there are a few mnemonic words that we can, or letters that we can look at to actually provide a pain assessment. And there is actually some, just a quick recording that we can look at through AusMed that gives us some idea of the PQRST pain assessment, which I'll play now.
The PQRST mnemonic, where P stands for provokes. What provoked the pain? What makes it worse or better? Did the pain occur at rest or during exertion? Did the pain wake the patient up? Q for quality. This could be sharp, dull, squeezing, a slight pressure, a burning or aching pain, a pounding pain, colic-like or cramping, or a stabbing pain. R for radiates. Does the pain move anywhere? Ask the patient to point to anywhere where he feels pain. S for severity. Ask the patient to rate the pain on a scale of 0 to 10, where 0 is no pain and 10 the worst pain imaginable. T for time. Ask the patient, when did it start? Was the onset slow or sudden? How long has it lasted? Is it a constant or an intermittent pain? Does it come and go? Have you had the pain previously? Is it the same as previously or is it different from last time? And remember to document all your observations.
So that was just a very quick mnemonic regarding pain. And I just thought I'll quickly just go through a bit more of an extended mnemonic with OPQRSTU that looks at some of the questions that we may ask people about their pain when we're doing pain assessments. So onset. So we should really look at what were you doing when the pain started? So getting a bit of a history, getting an idea, how long you've had the pain, and did the pain happen suddenly or has it been happening for a while? So getting a sense of, is this an acute onset pain or is it something that's been chronic and happening for a while? So this provocation or palliation. So what makes it worse? So how long does it last? Is it, increases with movement, or do you wake up with pain, or is there a specific activity that causes it, or nothing really makes it worse? You've just got a constant pain, it's there all the time. Or what actually makes it better? So do medications help it? Does heat, cold, massage, changing position, being active or resting, do these change how the pain is or improve it? And how long does it last? So is it something that might only last a few seconds, or you might have a constant pain all the time, or you might have it until you take some pain relief. So when we're looking at quality, we're looking at, the sense of how does that pain feel? So what is the quality of it? Can you describe it? So some of the words that we use, and we try and get people to describe their own pain, but sometimes we might need to prompt them. So is it sharp, dull, stabbing? Does it feel like pressure? Is it a crushing pain? Is it a throbbing pain? Or if we're looking at maybe those neuropathic pains, that shooting or burning pain, or a twisting or stretching. So there's a lot of words to describe pain, and that sometimes gives us a pretty good idea of what the cause might be and what might help it. So the next thing to be aware of is we also want to know where it is. So where's that pain located? And I often I often get people, particularly if they've got back pain. I don't know about other people, but I often get people to actually point to my body, so that, you know, if people can't, you know, sometimes if you're a bit incapacitated, or, you know, just have difficulty pointing to your own self, it's okay on the front of your body if you can reach it. But if they can't, like, just to actually point to it on me, and then I get a sense of where the pain actually is as well. Okay. And then we know where it is, and does it extend? So does it go anywhere else? So as I talked about, that liver pain, often it's right across your tummy, goes into your back, or another common one might be your sciatic type pain. So you've got pain in your lower spine and into your buttock, and then it travels down your leg. So we want to know where it starts and where it goes to. So fairly comprehensive sort of assessment. Then we look at severity of pain, and when we're looking at severity, we're usually looking at we use the faces because that gives us a bit of an idea. And if you're unable to sort of verbalize where your pain is, sometimes you're able to point to the faces, so, and what it feels like. And we usually use a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain that you can experience. And we often ask people what their pain is now, what their pain is when it's worst, and what their pain is when it's at its best, and does it ever go away? Okay. So sometimes that concept of severity of pain, people putting a number on pain, is quite challenging and quite difficult for people. So you can sort of say to them, you know, is it mild? So we say that mild pain is 1 to 3 in that sort of area, and that 4 to 6 is like a moderate pain, and then 7 to 10 is a more severe pain. So we do want them to be able to sort of tell us, is it mild, moderate, or severe? Because that gives us some idea of what we're working with. And so if they can't give you a number, then they might be able to give you an idea of where it is. And as I said before, we look at when's it at its worst and when it's best. Okay. The other thing to do is, if they can't really define the severity of it, you know, we ask them what it does. So does it stop you doing your activities, or you know, stop you having a shower or whatever? Does it make you, do you feel like you have to sit down or lie down or slow down, all the downs? So just so we've got some idea of the severity of the pain.
We've lost the slides.
I've lost the slide again.
Your screen share went away.
Oh, hang on,
Oh,
I must have pressed in the wrong spot.
That's good.
Okay, so T is for time and treatment. So what were you doing when the pain started, and what time of the day is it worse? So do you wake up with pain, or do you wake at night with pain? Or does it get worse as the day goes on? And I guess it's getting as an idea of, is it always there? Does it come and go? And are there any changes in the pain since it's first started? And then we always want to know, what are the current medications people are taking, or what have they taken in the past that's helped, I guess, too. And do they actually work? Because, you know, not much good if you're taking stuff and it's not actually working. You know, are there other side effects? Is there, you know, have people noticed that they feel nauseous when they take their pain relief, or, as we know, constipated, or whatever? So getting some idea of what's happening for them. Okay, and finally, our U is understanding the impact. Okay, so asking them, what do you believe is causing the pain? What do they think is causing the pain? Because people often know, they often have some sense of what it is. And how's it affecting you? And how's it affecting the other people that you're with, so your family or your carers or whatever? And does it affect us managing our activities of daily living? And how does that impact on you? So that's just sort of a quick I think a quick way to remember how to do a pain assessment, and the fact that there's a lot of things to cover within that pain assessment area. So, and there are quite a few tools around for pain assessment as well. So, and within the aged care setting, I know that the programs that you use they usually have a pain assessment with them within embedded within that program.
Okay, so thanks, Chris. That's part 1 and 2 of our 3-part installment about pain. So we've covered this morning the pathophysiology of pain and pain assessment, and the third video in this series will be looking at pain management, and we'll get Chris back again for that. So stay tuned, and if you're watching these videos once all 3 parts are there, so just go straight on to part 3 and we'll see you there. Thanks very much.
And thank you, Chris, for your time.
Thank you very much.